Welcome to UITM Clinical Skills Program. In this station, you will learn how to perform speculum examination, smear tests and vaginal swabs. Obtain verbal consent. Inspect external vulval structure. Looking for skin changes, ulceration, discoloration, discharge, swelling and scar. Using the left index finger and thumb, separate the labia minora. Inspect clitoris, urethral meatus, labia minora, hymen, introitus and perineal area. Lubricate the Cusco's speculum. Part the labia minora with the index finger and thumb of the left hand. Hold the speculum with the right hand and introduce the closed speculum into the vagina with blades parallel to table or at a slight oblique angle. Insert the speculum fully into the vagina whilst applying pressure posteriorly towards the posterior fornix. As the speculum advances, keep the blades of the speculum closed and at horizontal position. Open the speculum blades gently until optimal view of the cervix is achieved. Tighten speculum screw to hold in an open position, with the speculum handle maintained at pubic area. Inspect the vagina, looking for character and amount of vaginal discharge, presence of bleeding, any lesions such as vaginal wart, and any skin changes. Inspect the cervix, note the color, position, size and surface of the cervix, and shape of the cervical os. Next, performing a vaginal swab. Hold the cotton swab by the lid with your right hand. To take high vaginal swab, rotate the swab tip around the posterior fornix for 10 seconds. To take endocervical swab, place the cotton swab tip in the endocervical canal and rotate the swab for 10-15 seconds. Remove the swab, place the cotton swab into the tube, secure and label the specimen. Performing a cervical smear test. Label the slide with patient's details using a pencil. Place the air spatula on the cervix and scrape the cervix by rotating it 360 degrees for 5 times in a clockwise direction. Smear the sample onto the glass slide. The glass slide must be fixed immediately with appropriate fixative solution. Liquid-based cytology. Check the expiry date of the vial. Ensure seal is completely removed from the vial. Insert the cervical broom so that the central bristles are in the endocervical canal deeply enough to allow the shorter bristles to be fully in contact with the ectocervix. Push gently and rotate the broom 5 times through 360 degrees in a clockwise direction. Remove the broom and rinse it immediately into the preservative fluid by pushing the broom into the bottom of the vial 10 times, forcing the bristles apart. Discard the collection device. Tighten the cap on the vial to prevent leakage. Complete the cytology test request form. Removing the speculum. Hold the speculum by the handles before loosening the screw. Ensure no foreign body is left in the vagina. Continue to hold the blades open while withdrawing the speculum until blades are free of the cervix. Slowly close the speculum blades while avoiding entrapment of the vaginal wall. Dispose speculum and gloves into the clinical waste bin. Take off your gloves and wash your hand. To supplement your learning, please access our CSL platform for more learning materials related to this station.